When I first came home and told my husband that I was going to be the director of Healthy Communities, he laughed and said, "How are you going to get out there and change everybody else and get them motivated to get up and go exercise when, we struggle with it ourselves?"
Healthy Communities provides access to legal assistance through our MedLaw program. We have a faith-based toolkit. We also have care coordinators.
We consist of marriage and family therapists, social workers, we have LPCs, we have nurse and health educators.
I can be in a patient's home and maybe need a resource and call one of my team members, and so we're able to work quickly.
Their job is to really build trust with patients in their own home and to be able to connect them to the services that they need.
Macon is a fabulous place to live, but the immediate area has some challenges. And when the Robert Wood Johnson County Health Rankings came out a few years ago, Bibb was 142 out of 159 counties.
One of the things that is perfectly clear in Georgia is that we have a deficiency of health care in rural areas.
Everybody's not going to come to the hospital. Everybody cannot afford to come to the hospital. So how do we help?
It really hit me that we have all of this knowledge, but we keep it within the four walls of the hospital. And so what we really focused on was actually taking it to the community.
For us to get to equity of care, we're going to have to lift up those vulnerable communities so that they're in a good place.
We had one situation with a patient who got sick through congestive heart failure and very shortly after that became homeless.
My life started going down here because I couldn't pay my rent because I wasn't working. I was walking by the hospital one day and I started feeling kind of bad, and I stepped into the emergency room. And when I went in there, they kept me. That's where it started, that I had a triple bypass.
Once we connected with him with Healthy Communities, our care coordinators saw that he could actually benefit from the help to get back on his feet again.
She really went beyond and above her duties, I'm telling you. And she stuck with me. Every day she came in.
The care coordinator put a lot of effort in and helped him actually find a place to live, get the treatment he needed, and he's back to working now.
We believe that people want to be healthy. And Navicent Health really sees that as part of our role to help them do that.
It's been real exciting to see that we're not the only ones that really want to make a change in our community.
I think Navicent Health has done a great job of identifying the problem, addressing the need, and going out into the communities.
We will always have vulnerable communities. Our work will never be done.
It's a good feeling when people come together as a community to work on a common issue.
Our intention and our desire to get to equity should never stop.
Our residents know that they've got a good place to go to for great health care.